Hello everyone, my name is Eva Lendaro and I'm a PhD student here at the Center for Bionic and Pain Research. I'm in my final year and actually I'm going to defend my thesis in a couple of weeks on September 10th. Today I want to talk briefly about what has been the work conducted during my PhD work, which has been centered around the use of phantom motor execution as a way to treat phantom limb pain. So this has been the central theme, and Professor Ortiz Catalan has already mentioned what is the idea behind using this way to treat phantom limb pain. This treatment has been first clinically implemented in 2014 with a case study, and then this study has been followed up on a larger population with 14 upper limb patients. And the results from these studies were promising. However, two things were left to determine after these studies. First of all, we needed to understand whether this treatment could be used to treat phantom limb pain in the lower limb population. And in order to do this, we had to extend the technology to the lower limb by devising a way to record EMG signals for the therapy on lower limbs. And then we show the efficacy of the treatment on a case study. The other thing that was left to determine, however, and is still to determine, is the extent of to which the pain relief that we observe during these therapies is actually due to phantom motor execution, and the amount of and to what extent pain relief is instead due to other factors other than motor execution, which could be, for instance, the placebo response. And the only way in order to determine this is by running a randomized controlled clinical trial, possibly double-blind. We have been working on this in the last 4 years. We have published the protocol, and we also have recently published the statistical analysis plan, and we really put effort in order to eliminate all the possible sources of bias. And therefore, this study is, for instance, a double-blind. The study is still ongoing. We have terminated the treatment phase, so we have been able to log the database relative to the treatment part. And we have some primary results relating to the primary outcome, and we are going to present them in a couple of days at the ICPLP conference. So if you're interested, just tag along for the conference, where we are still running the follow-up at this point. One thing that becomes of interest when using surface EMG to treat phantom limb pain via myoelectric pattern recognition is to understand whether we can enhance the patterns, these myoelectric patterns of activation, by training. And we have been running a study focusing on one specific muscle, the bicep brachii, and we've seen that by using biofeedback we can enhance this differential pattern and thus increasing the number of control sites available for the therapy. Another thing that we've done, and because it's important when implementing the technology clinically, is finding ways to record in a user-friendly way. So we have developed this garment, this smart exile band that can be put on in a fraction of the time that would be required with conventional electrodes, and the performance of this band match that of conventional electrode. Another thing that we've been doing is to show that this technology can be taken by patients at home and being used independently. And we've been running this qualitative study with a medical anthropologist and also a human factor researcher, showing how these patients really adopt and integrate the technology in their daily life. Finally, another line of research during my PhD has been to look and investigate for neurocorrelates and biomarkers of phantom limb pain. And one thing that has been done early is to look simply at the resting state power spectrum on a small subset of patients. And we've seen already early on that there might be a difference around the alpha band of the EEG power spectrum. That is enhanced, we see this peak in phantom limb pain patients. So more recently, we have been running a more advanced study, let's say, on a larger population, and we'll be using advanced machine learning techniques in order to see if we can predict whether certain ENG signal comes from a patient in pain, or comes from an amputee without pain. And we've been seeing that it is possible actually to predict pain pain using EEG with a decent accuracy. The best accuracy we got was 93.7%. But this is preliminary results, and we need to investigate further. And finally, we are running also an fMRI investigation to look for neural correlates. And that's everything for me. So if you have questions, you can send me an email, or if you're interested in following my defense, you can also send me an email, and I will send you the invitation.
Hi everyone, my name is Mirka Buist and I'm presenting a sensory training for neurorehabilitation and phantom limb pain treatment. So Eva just explained a treatment where we train the sensory motor, where we train the motor part for people with phantom limb pain. But of course in these people there is not only the motor system, but there is also a sensory system to consider which has been affected. So with this new treatment, mindful sensory motor training, we want to combine training for the motor system and the sensory system together. For this, I have been asked to design a device that can give tactile feedback in the affected limb of these patients. So here you can see the device that I designed last year for my master thesis. In this device we have different kind of mechanisms that can stimulate the skin in the arm or the leg. We have a tactile grid that can give touch or vibration sensations, and a set of bands that can give compression, sliding and strain sensations to the skin. All of these together will give different kind of sensations to all kind of mechanical actuators in the skin, or all kind of mechanical receptors. To test this device, I'm currently running a study with able-bodied participants to verify if sensory training has an effect on the discrimination abilities in the skin. For this we use different kind of tasks to, we ask the person to discriminate between different kind of sensations. For example, we stimulate a vibration in the skin and we ask them, is this a high vibration frequency or a low vibration? And we also incorporate these kind of tasks into games, such as a memory game, where you have to find, instead of two similar images, you have to find two similar sensations. With this we run a study of a couple of sessions, and before the first session and after the last session we test the 2-point discrimination and a monofilament test to see if the learning of the sensory discrimination has improved. And eventually the goal is to combine this with the motor training, so that you can play, for example, a game where you have the motor control as input, so you can move to the left and the right by using your own muscles, and you get feedback from this sensory device, besides the visual feedback on the screen. That's it.
Hello everyone, my name is Shahrzad Demircheli. I did my master thesis and recently started my PhD at the center. The main focus of my PhD is about phantom pain limb rehabilitation. I'm kind of complement what Eva talked and Mirka. As Eva said, we tested PME on patient with amputation. We have very good result of that study, but it didn't work for few patients, and also it's a standard form. It's not applicable for all people suffering from PLP, like people with highly impaired extremities. So we tried to improve the efficacy of that treatment by integrating it with sensory training with the device that Mirka was working on that. Yeah. Here you see the application of the mindful sensory motor training on a patient with transhumeral amputation. The intervention includes 3 modalities: motor training, sensory and sensory motor training. Can I play the video here? Yeah. Here you see the patient is playing a Tetris game, which is part of sensory motor training. It's in invisible mode, so he doesn't have visual feedback, and he discriminates or find the location of the blocks with the tactile feedback he's perceiving with the sensory device, and he's having control over the phantom movement with the over the movement of the blocks with the phantom hand movement. We also try to improve the efficacy of the mindful sensory motor training to include other people suffering with PLP, and also we adjust, like, the main purpose is to improve the efficacy, not only cover other people. But anyway, we also adjusted to, we try to adjust the treatment to cover other people, for example, with highly impaired extremities, like people with dysarticulation. But to do that, we did the literature review on the application of transcranial direct current stimulation for the treatment of phantom limb pain and its mechanism of function, where we found out that it's been used, the TDCS, as an adjunct to other treatment, such as treatment based on motor training. Like we were thinking it's also going to be applicable for PME. So, and also it's been used as a by targeting the primary motor cortex associated with the site of amputation. Here, based on the mindful sensory motor training and the TDCS, we started a single-arm clinical trial for the people with highly impaired extremities. Here you see a brief description of that. Like it includes pre and post assessment and 15 interventions where they receive the treatment and will be followed by long-term follow-up assessments. In another study, we are trying to investigating the effect of TDCS on the improvement of molecular pattern recognition performance. In this study, we are testing TDCS on healthy participants, and we want to evaluate its effect on the non-dominant hand. And to do that, we are comparing the classification accuracy before and after receiving TDCS, but it's ongoing. Yeah. Thank you. Any questions?
Hi, my name is Malin Ramne, and I am a PhD student here at CBPR, studying mathematical and computational models of phantom limb pain. Now, at first glance, it might not be entirely obvious why one would use mathematical models to study something like pain, but for me, coming from a background in physics and engineering, and for many others in our team, we know that mathematical models and simulations are a key tool to understand any kind of complex system. Mathematical models have been applied to pain in many cases before, but unfortunately these models haven't been able to entirely capture the complexity of a condition such as phantom limb pain. So there are still many open questions to ask, and we believe that we can use dynamical systems theory and other mathematical models to investigate what's going on in the nervous system after an amputation that would lead to phantom limb pain. We are still very early on in this work. I started my PhD earlier this year, but we have started attempting a first model of phantom limb pain. And in this model, we are looking at the first relay site of pain signals from the periphery to the central nervous system, which occurs in the spinal cord. And the idea here is to model the activity of different neurons involved in pain transmission in the spinal cord. And by doing so, we have been able to recreate several typical pain characteristics that have been observed, such as wind-up or inhibition of pain by non-nociceptive touch. And the next thing we want to do is to study what would happen if we remove the peripheral input to this model and maybe have spontaneous activity, which has been observed in damaged nerves, and in that way model what would happen after an amputation, and then study what the behavior of these different neuron groups would be. But that is still some work that we have in front of us. And another project that I am also involved in, that Max previously mentioned, is an app for tracking long-term pain tracking. And the idea here is to both give pain sufferers a better way of tracking their own pain, but also for us to be able to collect and analyze data on pain and study how pain characteristics develop over time, for example, after an injury or during a treatment or therapy. That was all for me. Thank you for listening.
Hello everyone, my name is Emily Pettersen and I'm a first year industrial PhD student at Chalmers and Sahlgrenska University Hospital. And my background is in biomedical engineering and bioengineering. And I started in the research team as a master student, where the purpose of my thesis was to investigate if electrical stimulation could accelerate osseointegration and if different stimulation parameters was more beneficial than others. I pursued an in vitro study where the findings suggested that electrical stimulation could be a favorable approach for stimulating OI, and that this effect is more beneficial in a dose-dependent manner. And the main focus of my research in my PhD is about improving surgical solutions for amputation, including both aspects of pain and function. So one of my main projects aims to investigate phantom phenomena in non-amputees during axillary blockage surgeries. So the idea of this project arose after CBPR director Max hand surgery last year, when he experienced a phantom. So our idea was to extend this into a larger study, where non-amputees are interviewed before, during, and after surgery regarding their phantom sensation, position, pain, and movements, in order to receive a better understanding of the phantom. And we will track the phantom movements with a leap camera using the contralateral arm that Kurt talked about earlier. And these aspects are important in our work, both in prosthetics and phantom limb pain. Another main project, in collaboration with the hand surgery department and the orthopedics, is about comparing the effectiveness of 3 different surgical treatments for alleviating post-amputation pain in individuals with an amputation. So the project is in an early phase, but the purpose is to pursue a randomized controlled trial where the 2 contemporary reconstructive surgeries target muscle reinnervation, TMR, and regenerative peripheral nerve interface, RPNI, are compared to each other and to a neuroma transposition procedure. And the primary outcome is to track neuroma pain intensity before and after surgery, and we will also track stump pain and phantom limb pain as secondary outcomes. And recruitment for this study starts this fall. Thank you.